Everyone. Thank you so much today for joining McGraw-Hill for the Art of Storytelling, Tips on Unlocking Learning Potential and Engagement in Lectures, presented by Dr. Lauren Davis. We're so happy to have you here today, so thank you for taking the time to meet with us. Before I introduce our speaker properly, I'm going to go over a little bit of brief housekeeping. So first things first, you are muted. I promise. I cannot see your camera. I cannot hear you. You are totally muted. So eat your lunch, sip your coffee, whatever it might be, you are muted, I promise. Second, this webinar is being recorded. You will receive a link to the recording if you registered for the webinar. So that should get sent out in just a couple of days. Watch your email for that recording after the webinar. Last but not least, questions are encouraged. We love questions. Dr. Davis is a great speaker and question answerer. So if you have questions, please put them in the chat at any time. We are going to answer questions at the end, but if you think of a question, I'll be organizing those as Dr. Davis speaks. So feel free to put it in the chat, and that will show up for everybody unless you message the host privately. But if you really do want to ask something anonymously, you can also utilize the Q&A function within this meeting today. So a couple different ways to ask questions. Please ask them, and I will be organizing those for Dr. Davis to answer at the end of the call. And with that, I'm so excited to introduce Dr. Lauren Davis. So let's get started, and then she can take it away. All right. So, as the owner and lead physician at Latched Nourished Thriving LLC, Dr. Lauren Davis is a DO who is board certified in both osteopathic and neuromusculoskeletal medicine, specializing in integrative and functional medicine, osteopathy, and breastfeeding medicine. Oh man, I hope I said osteopathy right. Osteopathy? Every time. Dr. Davis has taught me how to say it, and I get it wrong every time. All
You
right.
got it right this time.
Oh, yes. Thank you. Dr. Davis is a former chief resident of the Integrated Family Medicine and Neuromuscular Medicine at Stony Brook University's Southampton Hospital and a former national undergraduate teaching fellow at Lincoln Memorial University, specializing in osteopathic practices, principles, and gross anatomy. Dr. Davis has given many lectures on topics pertaining to anatomy, osteopathy, and sports medicine. She's board certified in family medicine / OMT by the American Osteopathic Board of Family Physicians and osteopathic neuromusculoskeletal medicine by the American Osteopathic Board of Neuromusculoskeletal Medicine. There we go. Dr. Davis is also founder of Latched Nourished Thriving, a holistic platform empowering mothers through their breastfeeding journey. Dr. Davis is deeply passionate about women's health, nutrition as medicine, supporting peak female performance, and championing women through the fourth trimester and beyond in their motherhood journey. Dr. Davis is the author and voice of the OMM series On Boards and Beyond by McGraw-Hill. All right, Dr. Davis, please take it away.
Thank you, Caitlin. So it is wonderful to be here today. If some of you joined us at ACOM, we had a wonderful time doing this lecture, and it was requested so much they asked me to come back and do it webinar style. So I hope that everyone is settled in. Again, put your questions in the chat as you have them, as they come up. If they're answered later on, great. If not, I promise we will get to them at the end. So let's get started. So again, just briefly, I'm Dr. Lauren Davis. I'm dually board certified in both family medicine and neuromuscular medicine. And I also work as a content creator with McGraw-Hill on their Boards and Beyond series. So you will hear my voice if you have heard the OMM lecture series. My clinical work, though, focuses primarily on holistic postpartum care. I'm also a homeschooling mom. It's my 3-time exceptional 7-year-old. And it is a passion of mine to figure out how to make learning more engaging, more fun, more humanistic, and more memorable. So, not only for my clients who I record videos for and have a whole video series about postpartum care, but for our learners here at McGraw-Hill and personally for my family as well. If you have ever dealt with ADHD or autism, which my oldest son has, things need to be quick. Things need to be educational and fun and everything in the experience needs to be done in a way that is engaging for him. So, to be honest, that is where I learned most of this in trying to figure out ways to get him more engaged in his own learning. So, we all know that the landscape of education is changing. Student attendance in traditional lectures is down. Learners want more autonomy, and we want to see how we can give that to them, right? We want to know that what they are experiencing not only is going to be good for them in the moment, but is going to shift their learning process to something that is sustainable long term. This means our teaching tools have been shifting and evolving too. And today I'm going to show you how storytelling is something that is deeply powerful, deeply human, and it's backed by neuroscience that can help us bridge the gap in learning. So, where are we exactly in today's education? Well, we have declining attendance at student lectures. Today's learners, especially Gen Z, have endless options when it comes to how they consume information. They're used to short form video. That is what they speak to them to each other, right? Recording small snaps, sending them off to their friends, and quick, fast-paced content. They also enjoy micro learning, so small, short clips for learning. Think YouTube, TikTok, Reddit, Ankidex. All of those are ways that our students are turning to learn. And honestly, that's what they gravitate towards because it's what feels most familiar over what's most complete. Students prefer this for their independent learning and for their interest driven education. This also creates real challenges, though, for us as educators. When we have students who aren't attending lecture or engaging with the full length materials that we give them, we lose the ability to see how they're actually learning. Where are they turning? Where are they getting their information? And this makes it harder to identify who needs more help and support. It becomes nearly impossible to keep up with the endless ways and the endless options that they have and keep them accountable in a meaningful way. So, this means that we need tools that support both their autonomy and their accountability. So, instead of resisting the shift, we need to meet it. So, by integrating the elements that make short form content so effective and so comfortable for our new learner, we can incorporate short story structure. We can make our education emotionally engaging, visually appealing, and that's where the art of storytelling becomes one of the most powerful tools that we can have in our toolkit to bridge the gap between how students want to learn and how we know that they need to learn. So, here at McGraw Hill, we actively support this transformation. We're partnering with institutions and healthcare systems to curate digital resources that align with your curriculum and support your students' diverse learning needs. We're committed to providing high quality content, authored and vetted by clinical experts and educators, while leveraging technology that supports connection and real time learning. So, because we know that there are no two educators that teach the same way and no two students that learn the same way, our mission is to amplify what you do best while helping you unlock each student's potential. So, instead of trying to fight that shift, we can meet it by using the same principles that short form content creators use. And this is what storytelling gives us. When we create and craft an excellent story, we give the student the information they need in a way that fits into the way their brain already processes information, while helping us regain influence over how they learn. And that's what we're talking about storytelling today, because we know it works. Oral storytelling is one of the oldest traditions and one of the ways that educational material has been passed on for decades and longer throughout human evolution. So we know that just from an evolutionary perspective, this is an engaging and creative way that we can bring this information to our students. So let's look at why storytelling matters in education. So, the first rule of any good communication, which at its core, educational content is, right? It's communicating our knowledge to the next generation of physicians. And it's pretty simple. We need to know who we are speaking to. Because when we can know who we are speaking to, we can know what motivates them. And when we know what motivates someone, we can create a story that creates meaning instead of memorization. So, if our students are constantly filtering out for what is going to be relevant, whether that's in their clinical practice or more likely the next high test situation that's going to come up, they want to know what they are learning is going to be meaningful and impactful. So, let's look at who our students are today and how we can create that story to bring them in and draw them into our education. So, the modern learner, most of our med students are Generation Z. Let's take a closer look at them. So, research suggests that the average attention span of Generation Z is down to around 8 seconds. It doesn't mean, though, that they can't focus. It means they're constantly scanning, constantly looking for what is worth their time and focus. So we are wired, and especially Gen Z is wired for rapid information processing. And they respond best to content that's clear, that they understand is relevant, and that is emotionally engaging. That is one of the big differences in Gen Z is that they are hugely driven by their impact and their emotions. We know that if they have enrolled in medical school, that they are committed to helping others. They have so many options now to actually make more money in other avenues other than medicine. It's not the big draw anymore. They're here for help and impact. They're also drawn to microlearning. They're drawn to short form content. That is what they've grown up with. That is what they have always known. If we think about Instagram, Facebook, Snapchat, they're all reaching around their 20-year anniversary, about the age of our students. So this isn't new for them. This has been something that they have grown up with their entire lives. So, what does this mean for us as educators? It means that we need to do things that capture their attention quickly. And more importantly, we need to keep their attention without relying on the visuals or flashy gimmicks that they can have brought to them in short form content. So we have to speak their language. And that language is shaped by storytelling, curiosity, hooks, and emotional relevance. And we'll get to exactly what I mean by that in just a few minutes. So when I choose to do something new, I always look at who is already doing it well. Who is the expert in this and who is doing it the best? So when we look at this right now, that is marketers, that is content creators and influencers. They've mastered the art of persuasion. They've mastered story based frameworks for getting impact and creating change and creating momentum forward. And whether we like it or not, they're the ones teaching our students how to think, how to filter, and how to prioritize information. So the big question becomes, how do we bring those same exact principles into medical education ethically, meaningfully, and effectively? So we're going to dive into exactly how we can start doing that today. So how do we bring the principles and the power of storytelling, the same things that these content creators are using, to drive attention and memory in medical education? Because patient cases, clinical vignettes, and well told teaching stories aren't just engaging our learners, they literally rewire how students process and retain information. And here's the part that most people don't realize: much of what these content creators do, these influencers, they're using tactics from neurolinguistic programming, or NLP. NLP emerged in the 1970s when Richard Bandler and John Grinder studied how some of the most effective communicators, people like Virginia Satir, Fritz Perls, and Milton Erickson, were able to create rapid, lasting change just through language and stories. They modeled these communication patterns and they uncovered powerful structures for building rapport, for directing attention, and embedding ideas in a way that stick with their audience. Today, these same exact techniques show up everywhere, and NLP is huge in sales and marketing. And it's because it works. So these show up in the high converting scripts and the viral reels that our students are watching. And they work because they're based on how the human brain is wired to receive and remember information. This isn't just about entertainment. This is how learning works. So let's explore what storytelling actually is and how we can use it to transform how we teach. And I am an osteopath. So at heart, tenets are big for me. We have the tenets of osteopathic medicine, and there are also tenets of storytelling. So, how do we apply these tenets in a way that's useful in the classroom? So, at its core, storytelling is the act of sharing a narrative. So, it's using words to create images and emotions and connect with the audience to deliver the meaningful message. In medical education, it becomes a structured way to teach complex ideas while also building context, empathy, and memory that students are going to have access to now and in the future. So, here are the key elements you want to think about when crafting a story. First, know your audience and know the message that you want to deliver. Before you can tell a story, we need to clarify who we are speaking to. So, that is the student in the room, and we can create what's called an avatar, right? A stereotypical person that is receiving our communication. And then we tailor our communication and our message from there. So, what is the core of your message that you want to land? What are the key points from your lecture that you want the student to take away with them? On average, it takes hearing a message 3 times in order for it to stick. So, repetition is key. Repetition is key. Repetition is key. See what I did there? So, this keeps the story both focused and intentional and signals to the brain that this is an important piece of information that I want you to carry forward with you. We also need to hook our audience. So, think about the last thing that you watched, whether it be short form social media, your favorite new Netflix series. It starts strong. It starts with something emotionally engaging and compelling, and it sparks either curiosity, urgency, or that emotion that we need to know what happens next. You want to pull someone into your story before their brain checks out. So set the scene, introduce the characters in a way that creates tension and drama. This helps the learner engage with the environment. It gives them the main character to follow, whether that's the patient, the provider, or even better, putting themselves into the hypothetical role. Because our brain doesn't distinguish between whether we are living an experience in true memory or whether we have created that memory hypothetically. It will help encode that pathway even better when we can do that and when we do it in repetition. Next, we build the tension. So we introduce the challenge or the moment of uncertainty or question that needs to be answered by our main character. This is what tells the brain what is going on, where we are going to, and then create that tension so that something feels unresolved. This is what creates the investment of our focus. This is what tells the learner to stay engaged. We build up that tension, build it up to a peak, which we call climax and resolution in storytelling. So, this is the emotional or the clinical turning point. This is the part that locks in learning. So, think about yourself going through different situations and scenarios through your own clinical training. What was that moment? What was the aha? That's your climax point in the story that you want to build to. And when we build to that point, we want to create this in vivid detail and narrate our own internal experience. And we want to do that so that the person we are talking to puts themselves in as the main character so that their brain can encode it even better. So we look at resolution next. What happened? What was learned? Why did it matter? And most importantly, how we were internally feeling. Because sharing our internal sensations with someone else helps to encode that memory even more. Finally, we give a call to action. So end with what you want them to take forward, whether it's a new way of thinking, a diagnostic clue that was new to you, or a red flag that they never want to ignore in clinical practice. Make sure that the story leaves them changed. Sometimes it's the poor patient outcomes or our own learning experiences that give this the best meaning. Let me give you an example. So, one of the stories that always goes with me is a story that was told to me by one of my mentors, Dr. Stephen Miller. And he told the story of a young man in his 30s who had high blood pressure, who he had prescribed a beta blocker to. And the story goes that he developed erectile dysfunction as a side effect of the beta blocker. And that erectile dysfunction impacted him so much in his life that he committed suicide. That is one side effect of a medication that I will think about every time before I prescribe. And I will make sure to tell my patient that this could be a side effect or a situation that they need to look out for. And if it happens, to tell me about it right away. That changed my clinical practice. One story, one setting, one clinical scenario that was passed down to me in a way that I could never forget. So, when we break down each of these elements in the next few slides, we'll show you how to map them directly into the brain and how it can land the best for the learner. So, how can we craft better stories in medical education? So, now that we've covered the foundational elements of storytelling, let's talk about how to craft these stories better, and not just the kind that capture attention, but the ones that build memory and insight. So, you don't need to be a novelist to do this. You just need to be intentional with how you structure a clinical case or a lesson so that it mimics the natural arc of a story. We're going to walk through each and every step, from the hook to building tension to delivering the insights that stick, and what makes teaching stories effective. It's not length or complexity, it's choosing the right moments to guide the learner through them with clarity. Anchor the lesson with emotion and give them the reflections that they need to have. But first, let's talk about how storytelling works. So, let's talk about what happens inside the brain while we're listening to a story. So, this isn't just about engagement, it's actually neuroscience. So, when a story is told well, the brain of the listener starts to sync with the storyteller's brain. It's a process that we call neurocoupling. Their brainwaves literally start to mirror each other and sync up. So, this synchrony creates a shared cognitive space. It's like a tuning fork effect. It aligns the mental models between the speaker and the listener, helping complex ideas land much more easily. So, this phenomenon was studied in 2010 at Princeton by Stevens and Hassan. They found that when the communication is successful, the listener's brain actively mirrors the speaker's, sometimes even anticipating it. So, that is the power of creating a good story. So, think about what that means for our learners. A lecture may hit the language centers, but storytelling recruits the whole brain into the relationship with the material. And when we create that whole brain engagement, we increase retention, we increase absorption of the material so that it's more accessible to our learners in the future. Storytelling activates even more of the brain. So, what parts of the brain are turned on the most? So, the brain lights up something called the default mode network. This is the network that's usually thought of to be involved in daydreaming, self reflection, and imagining the future. It's also involved in empathy. Think of it as the brain's resting state mode. More accurately, it's where we process identity, it's where we store long term memory, and where we simulate possibilities of the future. When we're listening to a story, it switches on in full force. So, traditional lectures activate the language centers, they activate that passive knowledge absorption, but storytelling lights up the hippocampus. It turns it on to encode new memories. It turns the amygdala up for the emotional engagement. And it also increases the sensory cortices for an immersive experience when we use the language to engage this portion of the brain. And this is crucial. The default mode network needs to be turned on for integration and meaning making of what we are telling them. Even more fascinating, it's not new. It's deeply ancestral. So long before textbooks and slides, we sat around fires. You can picture yourself sitting next to a grandmother, a grandfather, an aunt, an uncle. Hear the crackling of the fire. Feel the warmth on your face. Think about the stories that they told you when you were a child about morals, about right and wrong. All of these things come back to us very clearly and vividly. It's because our brains are wired to learn through a narrative. It's how knowledge, wisdom, survival skills have been passed on. The more parts of the brain that we can activate, the stronger the memory trance we create. So, storytelling mimics the way we evolved to learn. So, it's not just engaging, it's biologically optimizing for the learning potential of our students. So, now that we understand how the memories are encoded, let's start talking about the practical applications, how this plays out in medical training. When we teach through story, especially patient cases and clinical vignettes, students aren't just memorizing symptoms and treatments. They're building mental models for decision making. So, patient stories create what's called episodic memory. Instead of isolating the facts, learners learn to tie this and recall the flow of events. So, the timeline, the labs, the decisions made, the emotions involved. It becomes a memory that they can cross reference in the future. In this way, clinical storytelling becomes a form of mental simulation training. So, just like elite athletes who rehearse plays in their mind to boost performance, medical students can rehearse clinical scenarios through this narrative process. And when we teach in this form, we are then teaching our students how to pass this on in the future. The research supports this. Mental rehearsal improves performance across domain, from sports to surgeries. So when we teach through story, we help learners mentally rehearse success, build confidence, and develop their own clinical intuition before they even touch a patient. Think about how impactful that is as a learner. Storytelling also strengthens communication, especially the kind students need with patients. So, when learners are trained to listen to the patient's narrative, not just their symptoms, but their entire story, they begin to pick up on the deeper emotional and social context. They learn to attune, to ask better questions, and to build trust with their patients more quickly. So, by teaching through this model, we are literally creating better clinicians. And it also works the other way too. When students can use a narrative based explanation, they're then able to explain their rationale and reasoning about how they got to a diagnosis, about what the risks of care and what the risks of interventions are more effectively, especially to patients who are feeling overwhelmed. So we're not just training diagnosticians, we're training future clinicians to be interpreters and translators of the human experience when we can communicate in a storytelling fashion. And let's not ignore the benefits to exam performance. Board examinations focus heavily on case based questions. Students who are fluent in narrative logic, who can follow the arc of a patient vignette, perform better than those who rely simply on rote memorization alone. That's because stories trigger multiple memory systems at once. They're emotional, they're spatial, and they're sensory. And this makes recall easier under pressure and improves long term retention. So, storytelling doesn't just make for a better classroom, it makes for better board scores, better clinical communication, and ultimately better doctors. And that's what we use here at Boards and Beyond. So Dr. Jason Ryan started, and we've perfected and now brought to this osteopathic knowledge as well. So now let's shift from the brain science and outcomes to craft the structure of a story, how we can use it to spark someone's attention and then keep it. One of the most powerful techniques in storytelling is what we call an open loop. It's when you introduce a mystery, a challenge, or a question. But the key is we don't resolve it right away. We leave that question hanging. And that tension is what helps process the story in our memory. It taps into a cognitive bias known as the Zeichenarg effect. The idea that we remember unfinished tasks or unanswered questions better than completed ones. The brain does not like loose ends. So when you start a story and leave something unresolved, the learner's brain keeps that file open, waiting for that resolution. And this tension drives their focus. So, how can we do that in medical education? So, you can start in media res, meaning in the middle of an action. So, for example, you're in the ER and your 32-year-old colleague collapses in front of you. What's your first thought? Boom, attention grabbed, thought process engaged, and the person's now emotionally engaged in that story. We can pose it as a question. What would you do if a patient suddenly couldn't speak? That triggers problem solving instincts and pulls the learner into the situation or scenario. Even simply setting the scene with vivid, sensory rich language can open the loop and spark curiosity. It's 2 a.m. You're in the ICU. You're just starting to doze off when the alarm starts to beep. The key here is to hold off solving the problem you've introduced. Let the learner's brain lean in. That's what keeps them mentally engaged in your lesson, searching for the answer. And if you really want to up the ante, we do what's called nesting the loops. We create 2 to 3 unresolved storylines and weave these together, stacking that curiosity and deepening their focus. It's the same way that cliffhangers keep us watching in binge watching our favorite TV show. These are open loops that keep students immersed in the clinical reasoning. So they want to know what happened, what did I miss, what is going to happen if I don't know this in the future, and what would I do? We're answering their biggest questions. Why is this most relevant to me? Simply by crafting the story in a different way. Now that we've opened a loop, the next step is to choose the moments that matter the most, the ones that create emotional impact, drive our decisions, or where we gained insight. So every powerful teaching story has 2 to 3 of these what we call snapshot moments. These are the emotionally charged scenes that we want to encode in the learner's memory. It's not the entire case that they'll retain. It's the moments where their heart rate goes up or where their thinking shifted. And when we drop them into the lessons we've learned in the first person narrative, we do this even better. So ask yourself, what is the emotional pivot in this case? What moment carried diagnostic tension? When was I thinking, did I get the diagnosis right? Is this the right thing? Am I treating the patient in the right way? Or what scene shows the human experience of this case the best? Those are the ones we want to pick as our snapshots to tell in detail. So we do this by making these scenes even more memorable. So we immerse the learner in the scenes using sensory language. And here's what's fascinating: the brain doesn't easily distinguish between its own real memory and this vividly imagined one. So when a story is rich in sensory detail, the brain encodes it the same way it does a lived experience. So you're creating these memories during the first 2 years before we even get to clinical situations and scenarios. This means we can tell clinical stories in a way that's less pressure on the student, lets them see it, hear it, feel it, sense it, know what it's going to be like to be there, but they're practicing it in a low pressure situation. So we remember best when we can engage all of our senses. Visual learning includes words like picture, see, bright, dark, look, observe. We then stack on top of that because about 60% of our learners will be visual. 20% will be primarily auditory. So, auditory language we can include by saying things like, you hear the monitor start to beep, or there's a moment of silence and then chaos breaks loose. We can add in, for the other 20% of learners, kinesthetic language. And this brings them into what is happening in their own body. So your chest tightens. We feel the tension. You feel the weight of the diagnosis. Can you grasp? Can you hold? Can you tense? Can you allow that to hit within you so that we can encode this even better? So let's take a flat clinical fact and turn it into a lived memory. So if we're teaching about, let's say, heart failure, we can talk all about what is happening in the physiology. But when we bring up a picture of a patient, when we describe the sound of their breathing, the smell of their breath, we describe the family in the situation who is also worried about their loved one. And what we do to distinguish between, say, CHF and an acute MI, we can then tie those facts to those memories, which helps students to mentally capture them in the future. They're going to know what it's like to be there when they encounter it the first time. And it won't feel like the first time for them when we teach in this way. So these moments become the information that they can access in the future because they were truly felt, heard, seen, felt. And we take away that pressure by crafting the story in this way. We then want to deliver the insight that's going to make it stick. Once we've created that immersive experience, we then arrive at the most important part of the story, the climax, the tipping point, the point of biggest tension, the moment where something absolutely had to shift, where we had to act, or where we had that, oh my God, I can't believe I missed that realization. So, from a neuroscience perspective, this is where the brain tags this as a lived memory. The emotional intensity we create sparks the amygdala to encode through the hippocampus, making this information into a long term memory instead of simply a short term remembered fact. This is why the moment of decision or insight in a story is so incredibly powerful. It's not just a learning point and a turning point for our character. It becomes what our learner will remember. So the goal here is to create a moment where the student feels the stakes, where they experience the empathy or confront that uncertainty. This is what makes it unforgettable. So you can use language like, and that's when it hits you, or in that instant, everything changed. This is how we trigger the brain to say, this is the important part to remember. You don't want to miss this. You realize now. All of these phrases cue the learner's nervous system that something important is happening. It sharpens their attention and it opens them up for reflection and deeper learning. So it's not just about adding dramatic flair to keep their attention, it's actually anchoring in the lesson in the moment of emotional resonance. So that's what transforms facts into wisdom that will create great clinicians of the future. After the climax, we want to move quickly into the resolution because we don't want the brain to stop there. We deliver the insight into the situation. The lesson becomes clearer. The meaning, the purpose of telling the story is made. And it's more than just stating what's happening. It's about articulating what it meant. What is the takeaway? What does the learner need to take into the future with them? This is the part of the story that gives the cognitive closure, which helps the brain categorize and then retain the information. And it also prepares the learner for the future application to recognize similar patterns or these moments later in their life. So you can use language like, here's what you'll carry with you. Notice the kinesthetic part. This is the insight that changed how I practice. Insight, visualization. That's the moment that students remember on their exam and in emergencies. So this is also the time to reinforce the key points. And what did I say earlier? It takes repetition. So we want to drive this home by saying it 2 to 3 times. What do you want them to learn and carry with them in the future? And point it out, make it clear. What do you want them to remember a month from now, a year from now, 10 years from now? When will this memory come up for them again? So, a strong resolution doesn't just end the story, it locks that transformation. It's the part that makes the learning stick. And everything we've talked about, using the narrative, emotional hooks, open loops, sensory language, it isn't just theory. It's already being used successfully in educational platforms like Boards and Beyond. So, Boards and Beyond incorporates storytelling in several ways. First, our focus is always clinical. So, we use clinical vignettes to serve as the anchoring for all learning. Each video starts with a patient case that gives context and meaning to the content that follows it, and it pulls the learner in right away and provides a real world framework for the information they are being given. Second, the videos are narrative based. They walk students through reasoning steps, decision points, common pitfalls, essentially telling the story of the diagnosis or a disease in a way that makes it easy to follow and remember. And most importantly, it's all backed by neuroscience. These approaches are engaging. They engage memory, attention, emotion, and it is more effective than a simple traditional lecture format. So when you're crafting your own teaching materials or leading live sessions, you're not just being creative, you're aligning with what actually works for how our learners' brains work. So if you need some help, go ahead, scan the QR code, look and see what Boards and Beyond uses in our storytelling principles. But I want to give you some more pro tips now that you can understand the why and the how behind storytelling in the medical education. So let's make this even easier for you to apply. So on the next slide, we'll walk through a handful of simple but powerful pro tips you can start using in your very next lecture to immediately boost impact, connection, and retention in the classroom. So let's break down some practical pro tips that you can use right away. Start with the emotions, not the data you want them to learn. If something made you pause, worry, feel awe, that is where you begin your story. Your own emotional response is a signal to the learner's brain that this is going to matter. The emotional hook grabs attention far better than any data we could put on a slide. It tells the brain to pay attention to what follows. So you master your stories by writing them out on paper. Write the ones that you are going to use as teaching moments and identify those 2 to 3 snapshots. Make them vivid in your own mind so that you can communicate them to your learner. Then layer in the visual, auditory, and kinesthetic cues to immerse them even more. Writing it down helps to encode it in your own memory so that you can really pass it on with pacing and language. Building to the climax. Then remember that climax and resolution should happen very quickly. We don't want the learning moments to be after the resolution because it's not going to encode into the memory. So don't rush through the middle, build the tension, and get them emotionally engaged. Once you hit the tipping point, be clear and concise in how you resolve the story. So it helps the insight to land. Narrate your thought processes. Don't just say what you did, say what you were thinking. Share your own internal dialogue in real time. I paused here because something didn't add up. That inner monologue helps the student learn clinical thinking and reasoning, not just what to do in any situation. So when there is cognitive dissonance, name it. Say something felt off. Say that intuitive discomfort was there for me. Teaching students to notice and trust these inner cues is the best form of clinical wisdom that we can pass on. So be vulnerable, share your misses. You don't need to have a polished superhero story of you coming in and rescuing and coming to the rescue. In fact, the mistakes, the uncertainties, and the near misses are what our learners are going to remember the most because it'll help them not make the same mistake in the future. They humanize the lesson, they build trust, and they activate emotional memory centers. So, if you'd like to explore more about the neuroscience behind storytelling or how it's already being applied in medical education, here are some excellent resources. You'll find research on neural coupling, the default mode network, how memory and emotion interact in the learning environment. There's also some articles here on the storytelling in medical microbiology insights, how Gen Z learns, and the growing evidence for NLP and structured narratives in improving academic outcomes. So these are here not only for reference, but for resources for you to dig deeper into how and why this works and to support your evolution as a teacher who doesn't just convey information, but truly transforms their learners. Right now, I'd like to open it up for questions. Kaylin, I'm having a hard time
Sorry,
hearing you.
that's all me. Oh my gosh, thank you so much for that great presentation, Dr. Davis. We do have some awesome questions from the chat. Keep those coming, everyone, if you have more questions. We've got about 5 minutes to give Dr. Davis some questions.
And I can stay for a few
So,
more if you want.
perfect. All right. So one question we had was, what are some tips you have, or like, how do I get to know the audience in the sense of figuring out something that will emotionally resonate with them? What factors do you consider when you're trying to figure this out?
So sometimes I will literally ask, I will say, what about this particular topic do you guys think is the most important to take away? Right. And that'll help me trigger, what they're already thinking about, or it'll help me identify where their big gaps are that I need to fill in so that I can fill in that information for them because there will be a lot of things that they don't learn. But don't expect that they haven't already turned to some outside materials and resources before a lecture to prepare. Some may be walking in blind, but polling is a great way at the very beginning to kind of engage them and see where they're at.
Great. Thank you. Another question we have is, what role does humor play or does humor play a role in storytelling in medical education?
Humor absolutely plays a huge role. So think about, positively charged emotions adding to the memory integration. We tend, this is my own thought here, not McGraw Hill's, I will caveat that, but we tend in medical education to expect fear to motivate our students. And we expect negative emotion and the fear of doing something wrong to be the primary motivator. If we can flip that narrative and get them to feel positive and to get the positive outcome and that experience for them better with things like humor, pleasure, joy, happiness, it will be a much better outcome in the long term for our learners because we don't just want fear based motivation tactics. It doesn't work in parenting, it doesn't work in education.
Thank you so much. Another question we have, what are some tips you have to create stories when you have content-heavy courses to teach? So especially when time is finite, Jerry gives the example of teaching pharmacology. So very heavy content-wise. What are some
Very
tips you
heavy
have?
content wise. You can pick out one or two of the most important drugs that people are going to prescribe over and over and over again and come up with clinical situations or scenarios for those. The other way to flip that narrative is to make a story about the physiology. You can name it and say, you know, uh, you know, uh, tumor necrosis factor A, right? Mr. TNF comes over, comes to the party. Let's talk about the inflammation cascade and then what the interactions between the drugs and the physiology are in a way that's engaging to the learner, right? There's some learning materials out there that do that already that create kind of skits about pharmacology to be able to learn and don't recreate it. You can go out there and look at them and look at what your students are already doing and then bring that into your lecture.
excellent suggestion, Jerry says. So thank you. I have a question for you too. I think sometimes if people don't see themselves as creative, like it can be hard to be like, well, I don't have any stories or like I'm not creative. Are there any resources you've used that have helped you brainstorm or structure, just like get those creative juices flowing?
It's already been created somewhere in the world. Someone has already done this, and someone has already made all of these things. We don't need to reinvent the wheel. It is out there. If you can't find it, ask Claude, ask ChatGPT. I'm sure it can find a resource for you somewhere that you can then bring into your lecture. I'm sure that this is only your own limiting belief that you are not creative. Everyone is creative when they let go of the fear of not being creative or being judged. And I promise you, your students are not going to care. They already think of us as the old people, millennials, Gen Z's like, ugh, millennial thought process, ugh, right? Boomer, right? They're already saying stuff about us. Embrace it, just go with it, and then be the quirky person that they're going to actually remember the lectures for and let go of that fear.
Amazing. You've talked on this a little bit too. We talked about the importance of humor. It sounds like maybe there's some importance to being, um, yeah, a real human and being vulnerable. Would you say that's true in storytelling?
It's absolutely true. And it's absolutely true in medical education, right? We are people, we are not robots, and we are not trying to let our jobs be taken over by AI, right? Humanizing medicine is what's going to be the future that keeps us here in medicine. So, people want to come interact with a person as a clinician and not a robot. Teach your students from the beginning how to be the empathetic person and how to talk to their patients using stories that are going to transform their patient outcomes right from the very beginning.
Great. All right. Well, we are right at the hour. Let me see if we have any last questions. We have some great suggestions in the chat for other tools people have found valuable for constructing their own stories. But
Awesome.
I think we've actually gotten to the questions for today. So I will say, as a reminder, everyone is going to get a link to this recording as well as Dr. Davis's slides. That should appear in your inbox in the next few days. So keep an eye out for that. If you have remaining questions, feel free to stay on the call. Dr. Davis has been gracious enough to give us a few more minutes. But everyone, thank you so much for attending today. Thank you, Dr. Davis, for your excellent um, sharing of your expertise. So thank you very much. All right, we've got a few more questions rolling in, but if you're at time, thank you for joining us. All right, so one question. How about biostatistics and epidemiology lessons? Would the concept of storytelling apply here?
Absolutely. We can create stories about anything when we get creative, right? So, if we talk about statistics, we can talk about, you have 100 people in the room. 10 of them are going to be affected by this. How can we guess who it's going to be, right? Create a question or a situation or a scenario that then backs up the statistics. Create tension between what you want them to learn and then what the outcome is going to be. Because eventually, right, most of these students are going to have to apply this clinically. And even if that's not your strength, even if that's not something you've done before, that's something that this learner is going to be thinking is, oh, how does this apply clinically? Well, it applies clinically because we need to predict who that's going to be. What biomarkers are we looking for? Are we looking for increased weight circumference for someone to develop diabetes? Are we looking at, stature? Are we looking at skin tone? What things are important to encode in our clinical brain that's going to be important for that lesson in the future?
Thank you. I have one more what about question and then maybe a
Mhm.
final question here. And this next question is what about laboratory vignettes in terms of storytelling?
Labs right? What is the concern? Why the heck did you order that lab in the first place? And why do you care when it's off, right? So, what is going to draw that learner in about the labs? You don't have to do it for every single lab. Some things we know are rote memorization. Give the apology. I know this is boring. I know this just needs memorized. It's important because, and give them the because that's what they're going to care about. Where am I going to use this? Why do I need to learn this? Why do I need to put my time into memorizing it? And then give them the clinical points that are going to be the most important, right? If we're talking about a positive ANA, right? It means nothing until, and give them the until of what will be after that.
Awesome. So my last question here,
Yep.
I'm not very practiced at storytelling. I don't have a lot of confidence in this creative area yet. Kind of two questions. Does my story have to be perfect when I tell it the first time? And who can I practice on?
You can practice in the mirror, right? You can deliver it to yourself the first time. You could deliver it to an empty computer, right? Take a snapshot of yourself delivering it. Use AI what it's best for. Ask it to make your story better. Ask it where could I have more put in more vivid detail into this case scenario? What are my snapshots that I need to pull out of this clinical vignette to really describe in detail? Describe it to a colleague, right? Hey, I'm giving this lecture. Can I run this case by you? Like, can I run this thing? I practice on my kids, right? It's pretty easy to see if they're actually engaged in the story that I'm telling because if I can engage my 7-year-old, then I can probably engage a room of adults who actually care about this.
Great point. All right, absolute last question, and then the doors are closed and we will all say thank you. But if I have a group of students with visual, auditory, and kinesthetic, I'm not totally sure of their learning styles. How do I decide which approach to use for them?
Right. So 60% of our learners will be visual, 20% auditory, 20% kinesthetic as their primary function. It doesn't mean that we can't cross over into other realms. The fact that we're creating a PowerPoint, students are more prone, right, more apt to have to learn how to be visual intakers. Make the visuals intriguing. Craft a story out of the visuals to make it easier on yourself. Incorporate the language and describe the others, or invite your kinesthetic learners to move around the room. You'll probably be able to pick them out because they'll be the ones either crocheting or have a fidget spinner or have to be typing or playing on their phone the whole time that they're listening. I promise you, they're probably actually listening better if they're doing that. So don't ask them to stop. That's their adaptation to improve their own learning because they've learned this over the years. But invite them to like move around in the back of the classroom if they need to get up and take a stretch break or just pace back and forth for a few minutes to calm themselves down. That's a way to engage them in the learning process that doesn't affect what you're doing in the lecture.
Amazing. Thank you so much for taking the extra time to answer those questions, Dr. Davis. Thank you everyone again for attending the webinar today. Again, you'll get a link to the recording as well as Dr. Davis's slides in just a few days. Thank you, Dr. Davis and everyone, and have a wonderful rest of your day.
Thank you.